Today, we'll talk about some early signs and symptoms of brain tumors. As you all know, brain tumors are not obvious, and sometimes just picking up these early signs and symptoms may help us in diagnosing them earlier and thus saving lives. So let's start about what are some common symptoms or signs which we can see in patients who have brain tumors. Now, a lot of us have headaches, a lot of us are suffering from migraine or some sort of chronic headache. But if you see that the nature of headache, that means the type of headache has changed. It may be used to be a different type of headache, but now the headache has become different in what it used to be from before. The intensity of the headache, or that means it's become much more severe, become much worse, and the duration and the nature of headache has changed from before. That may indicate that there may be something else happening in your brain which can be causing this. It is not necessarily that only a brain tumor causes headache, but then yes, if your headache has symptoms, other symptoms associated with it, like blurring of vision, excessive vomiting, drowsiness, or other signs which we discuss later, it may be a sign that there may be something else happening in your brain, and it's time to go and consult a neurologist or a neurosurgeon for further evaluation. So a danger headache for us is a patient who has headaches which is associated with blurring of vision. They may say that the vision has become blurred. They may have episodes or periods of complete loss of vision, especially on getting up from lying down position, which then tends to recover. It may have a lot of vomiting, especially early in the morning. It also may be associated with signs like weakness of one side of the body, of one leg, one hand, or difficulty in speaking. Then that means there may be something happening inside the brain which is causing this to happen. Let's talk about other symptoms of brain tumors. Seizures, or epilepsy in common man's language, or mirgi as we say. Suppose somebody develops new onset seizures. He never had seizures in his life, but now starts throwing fits. Not all seizures are like what we see in the movies, that somebody is shaking and become unconscious. It can be only shaking of the whole body, tightness or stiffness of the body, or only involving one leg or one hand or one half of the body. These are all different types of seizures. If somebody has a new onset, that means for the first time in their life they're having seizures, then yes, that may indicate that there may be a brain tumor happening inside the brain, and you have to see a neurologist, and we have to do further imaging after that. Suppose you develop blurring of vision, like I said before, you start finding that the vision has become blurry. You can't see well on the sides, or you can't see well on the straight. The letters or faces have become not so clear, or you have these periods where you lose complete vision, especially on getting up from lying down, or when your headache is very intense. This again may indicate that there may be a tumor happening inside your brain. Suppose you see that somebody known to you or a close family member has become confused, has developed these new behavioral changes, which a lot of times we take it as a sign of maybe stress or depression, but no, it's not the case all the time. Certain tumors growing in certain locations can cause behavioral or memory changes, which may include complete change in behavior from somebody being very nice and happy to becoming absolutely sad and depressed, or complete confusion or disorientation, or even loss of memory, can also indicate that there may be a tumor happening. And these signs are not to be ignored, and it's a sign that you have to see a doctor for the same. Now, if you notice a numbness, a recurrent numbness, weakness, difficulty in walking, difficulty in coordination, which is persisting or which is increasing over time, then that again may indicate there's something else going wrong in your brain, which means that something has to be done, some evaluation has to be done to rule out that there's no brain tumor happening inside the brain. Now, if we divide the symptoms and signs of brain tumors, we can divide them into two types. One is because of the increased pressure. Now, all we know that the skull is a closed cavity, is a closed space. You have the brain, you have some water, you have some blood. When something else starts growing inside, it causes increased pressure. There is no space for it to expand, which causes symptoms like headaches, blurring of vision, loss of vision, vomiting, nausea. This is called signs of increased intracranial pressure. That means the pressure inside the skull has increased because of a new growth which is happening inside. Other signs and symptoms can come because of the location of the tumor. Now, as we know, each part of the brain has a particular function. One part may be for hand and leg movement, one part may be for speaking, one part is for vision, one part is for memory. And the left side of the brain, in most people who are right-handed, controls the right side of the body and controls our speaking and understanding, and the right side of the brain controls the left side of the body. So a tumor happening on the left side may cause weakness on the right side of the body, may cause weakness, difficulty in speaking, difficulty in understanding. A tumor on the right side of the brain may cause weakness on the left side of the body. A tumor which is happening in the eyesight of the area near the optic nerves, which carry this eye signal, or an area which is part of the area of the occipital lobe which sees the vision, may have visual problems happening. Or a tumor in the temporal lobe or in the memory areas may have difficulties in memory or confusion or behavioral changes. So these are all different signs and symptoms of brain tumors which can be growing over time and causing these symptoms. If you notice this in yourself, anybody known to you, anybody close to you, then yes, it's worthwhile to go and get evaluated by a neurologist or a neurosurgeon at the earliest. But I still like to say, most headaches, this thing are not because of tumors. People coming with headaches who are brain tumors are extremely rare. Not every headache is a brain tumor. On the contrary, most headaches are not brain tumors. But like we mentioned before, when we have other dangerous signs and symptoms which are associated with it, that's the time to go see a neurologist, get yourself evaluated, and make sure that you get a tumor removed. If you notice the signs and symptoms which you have talked about, from headaches to seizures, vomiting, waiting, then it's important to meet a neurologist, a neurosurgeon, or a brain specialist at the earliest, because early detection of tumors, early pickup of tumors may make a tumor from being non-curable to curable. We may be able to cure a tumor, save lives, if we are able to pick up tumors earlier, when they are smaller, when they are in the earlier stage, rather than when they get very big, very large, or become very extensive. Thank you.